Just want to give folks one final reminder, if you could please stay in mute mode during the presentation. And I'm going to turn it over now to Elisa Benson, who's going to kick us off and get us started with the presentation.
Thank you, Kate. Good afternoon, everyone. It's kind of an interesting way to interact with a long list of people, many faces and friends and colleagues who were a part of this process. I want to welcome everyone to our community input HAT Plus gathering around our focus strategies work. We kicked all this off a long time ago. So it's great to sort of bring everyone back together. I'm Elisa Benson, Assistant CAO here with County of Santa Cruz, and have had the pleasure and honor of working with our HSCO team and focus strategies to do this work with all of you, which it's been a long 18 months, but I think a good one. I want to note who is hosting and helping this event today. We have Nicole Young and Stella Lauerman, who is doing interpretation. We have Kate Bristol and Catherine from our Focus Strategies team. We have Tatiana, we have Rainey, and we have Randy Morris, our Human Services Department Director, who is tag teaming the presentation of the framework today. So I will be sharing my screen shortly. We are gonna, as Kate said, take questions at the end. Please put your questions or comments in chat. There are quite a few people on the call, so it just makes it for easier management of the conversation, but we absolutely want this to be a conversation. So I'm gonna do the magic of sharing my screen. Everyone can see that okay? Someone give me a thumbs up. Okay, great. So why are we here today? Well, gosh, you know, we started something in April 2019 around our work together on the really critical issue of homelessness. And we're gonna walk through sort of this final deliverable with all of you today. We're introducing our Housing for a Healthy Santa Cruz, our strategic framework for addressing homelessness here in Santa Cruz County. And really the key is to sort of roll the framework out, get thoughts, and really focus on clarity of this document, and then really open to conversation around how to prioritize, how all of you can be part of the implementation work. I just realized there's one person I didn't introduce today. And you won't recognize his face, but we have Robert Ratner, our new Director of Housing for Health, our new division within Human Services. And so he is here today as well. And actually, though he just started his first day Monday, he's actually been incredibly gracious and participated in our development of this document for all of you today. So I just want to welcome Robert, and not just to today's event, but just to the Santa Cruz community. So sorry about forgetting about that. So here we are. We're going to start. I'm going to really, what do we have? Oops, wrong thing. Here we go. What are we going to cover? We're going to talk a little bit about how we got here. Many of you lived this experience right with us, so it'll be a little bit of a memory lane, and I'll be covering that. Then we'll be doing a summary of the framework, and that's going to be a little bit of a tag team between Randy and myself. Then sort of what are our next steps to finalize and really move on to implementation, and then we'll have time for a question and discussion about, you know, what we presented today. How did we get here? The big question. Well, we want to really, before we start, you guys are living this, and this is the presentation we've shared with several of our elected bodies. We have our last one tonight. But really, as you all know very well, this is a critical issue nationally, on a state level, locally, and you can visit any West Coast city and you see the challenge and the significance of homelessness in our community. We see the impact of unaffordable housing, poverty, addiction, mental health challenges, housing challenges just work challenges. This is what contributes to this. But here in Santa Cruz, it is just, we have a disproportionately high concentration of homeless people in our community. And this slide just illustrates that in terms of people experiencing homelessness per 10,000. We are nearly double the state average. We're not the highest, but we are one of the highest communities in California in terms of the concentration of experience of homeless people. All of you also know quite well the point in time count, but I always like to start with us remembering the specifics, that of the 2,167 folks who were counted in our point in time count last January 2019, about 78% of them were unhoused. 40% of them indicated that this was their first experience of homelessness, which is an important figure that we'll come back to, and it influenced our plan. You know, that 31% were identified as chronically homeless. We had 151 veterans. We had 122 families comprised of 419 members, including children. We had 51 unaccompanied children. And then one of the ones we all sometimes takes our breath away a little bit is we had nearly 569 transition age youth. So a very large percentage of of folks experiencing homelessness in our community are in that age group. So this is, this is what we all experience in this work, and we recognize, sorry folks, I've got a phone call. So I'll move on to our next slide. What brought us to this moment? We know how serious this is in our community. It was in mid 2018, right about the time right after I started here with the county, CAO Palacios asked me to take sort of an internal high-level look at our county response to homelessness. And it was really clear, while we had the all-in plan, while we had a big vision, even just within the county, we didn't have a super strong framework, performance-driven framework for implementing. And just as I dug into that question, listening from various parts of just the county family, that we saw that there were some gaps. And that prompted a recommendation from what we now call, or did call, Homeless Services Coordination Office. It was really Rainey and myself, a recommendation for bringing in some technical assistance. So all of you know, we got approval from the board in February of 2019 to start this, what was going to be a 14-month technical assistance engagement with Focus Strategies with Kate and Catherine and their team, are really around an in-depth assessment of how we were doing, and really then an inclusive approach with all of the partners on putting together what would an actionable improvement plan for getting better outcomes. So that's what the engagement was. All you have gotten to know Kate and Catherine and the team quite well. They are a nationally recognized firm who this is their committed area that they work in. They work with communities all over the country, and it's through data analytics, systems thinking. I think that's been a big thing we've learned along the way, and stakeholder engagement to really look at performance and operations and what it needs to be on the ground to make a difference. I just want to stress this. In one of the meetings we had an elected council member ask us about, well, can we look at another plan? Like, was this a copy from somewhere else? And it was an interesting question to answer because Catherine helped me out. It was like, no, we look at what's happening in a community and work with the community to move forward. That this isn't a cookie cutter plan. This is about what we all did together and identified together. So you guys all remember this. Phase 1, this was back in March 2019. There was a whole bunch of key informant interviews. There was a whole bunch of conversations and focus groups. I think Kate and Catherine read probably every document that has ever been written about our system. And the big outcome from that was our qualitative assessment and our interim recommendations. And those interim recommendations turned into work groups in phase 2. The other big piece of phase 2 was they dug deep into our HMIS data with not just as a system, but also with all of our partner providers, and really understanding on the ground how things are working. That led to a large quantitative analysis that we presented to the Board of Supervisors in March of 2020, which brings us to the unplanned phase. We had a pandemic and put everything on hold. And I think many people on this call will remember in early March, they got an invitation to a community convening, a 2-day set of workshops around these topics, around starting the action planning together. And go figure, here we are in a COVID world, and all of that came to a crashing halt. And we all turned towards responding and supporting our community through the pandemic. So while this really critical work around the system had to be put aside, so many of the people on this call came together around COVID response, particularly for our community members who are homeless. And we together stood up a COVID sheltering system. We have more shelter right now than we've ever had. It's a different approach to outreach and engagement. And all of this was done in a very collaborative way, and taught us some incredible lessons that have informed what we now have in the framework. But not for COVID, we would not have some of the critical recommendations we have today. And I think a greater confidence in one another and our ability to do this very difficult work together, because we've done a lot of stuff in the last 6 months that we were never able to do before. Phase 3, we actually moved towards the strategic framework and action planning. I just want to say along the way, our project advisory group helped us reboot several times, picking this work back up. And their advice was, bring forward the document and then let's talk about it. So that's what we're doing today. We're starting off, this is a key piece of our community conversation about this. And then the goal is to actually do a final adoption in January, along with the first official 6-month work plan. This has been inclusive and collaborative. I won't even start to thank how many people have been a part of this, but I think one of the really interesting moments was originally this was like the county's doing this. Cities were helping fund, but we were pushing this. So quickly that became our collective work. It wasn't the county, it was all of us relying on the opportunity to come together and look hard at how we're doing and what we're doing. And we looked at it and we're like, okay, here's what we're doing well, but we also were incredibly brave and open and honest about where the gaps were. And people have been willing to sort of step into those conversations. And it's just been an amazing thing for me to watch this go from a county thing to really, this is a community thing. We were all very, very involved in this process. Next quick conversation is although everyone kind of lived through this together, I want to just, for folks who maybe haven't been on the journey with us the whole time, just some quick reminders of what some of the key assessment findings were. And then we'll get into the framework. Strengths. The big thing was we had a lot of the pieces, whether it's, our shelters, we had basic services pretty much there, but that second set of support services were not ubiquitous in our system. Small supply of sort of specialty housing, those for folks with high needs. So not to scale, but we had that there. That we had, coordinated entry, we had HMIS. Again, all the pieces, but were they really performing at the level and interconnected at the level we needed to get to really have the outcomes we're looking for, which is getting people housed. Gaps, some honest conversations about gaps of like, did we have the most robust diversion and housing focused problem solving work in our system? That was an area we needed to do better. That our shelter needed to move beyond basic needs and really put people on a path to housing. And then the reality of we had a pretty low success rate in terms of exiting people to permanent housing. big one, and everyone from all corners have talked about this, that our governance and decision making is not transparent, or not really results focused, and that we had a very limited use of data to sort of drive our work, both at a decision making level and at an operating level, as a common feature of the system. Because I do want to highlight, there are some of our partners who are super awesome at data, but we don't use it collectively in the way we need to. And then really we didn't have enough staffing capacity. So I think we, as I mentioned, Kate and Catherine talked a lot about systems and that we had pieces in place, but how did we connect them? And really, I thought some of the language they'd used before was important to bring back for this conversation today, was that we needed to move from this loosely coordinated set of programs and activities that address some homelessness to a much more strongly coordinated, integrated system, that we needed to really collectively align our resources to shared objectives, that our programs were aligned to shared objectives, and that we use data to inform our learning and our work along the way. And then again, that clarity of decision making and process, that if we can do those things, we will be able to, instead of helping some folks that are homeless, really move to a place where every person has a timely and consistent response that gets them on a path to housing. So with that, I am going to turn it over to Randy to unveil the framework. Take it, Randy.
Okay, well, unveiling, unless you've watched Elise and I present at the board or any of the city councils, this is a repeat. But it's nice to see everyone and a robust participation today. I'm Randy Morris, and I'm the director of the County Human Services Department, and I started in February and got here, and I think a couple weeks later saw Elisa and Kate present what was soon to be coming my way, which actually, as of this Monday past, has transitioned from Elisa's leadership to the Human Services Department with Robert Ratner, who also just started on Monday. Before launching into this plan, a couple comments I want to make, and I hope this resonates with the group. You know, we're at such an unusual moment in history and in this country. But to just get particular about the issue of homelessness, this is a national crisis that is not unique to Santa Cruz County. And it's one that all communities are struggling to figure out how to manage. It certainly was one that in my former position in Alameda County, we were struggling to manage. And though there are unique aspects of any particular community, this is a systemic issue that is very historic, that have causes that go back decades, and it's very complicated to figure out the role of who is doing what. So if nothing else, as we go forward, I hope we can do a better job as county, at least in partnership with city and community, sort of teasing out the role of county, the role of city, the role of the community, and organize our focus on where we need help from federal government and state government as part of the solution, because this is a complex issue we're trying to manage. The other moment I want to recognize is when Elisa spoke to that unexpected third phase of this work, this little thing called COVID. What an unusual moment and nexus it has created that, you know, any community that is trying to develop, even if they had a plan, just COVID has created a moment where you have to sort of rethink and pivot for a whole host of reasons, up to and including we in Santa Cruz County and throughout California benefited from an infusion of money that we didn't have from FEMA, and then a program I'll say something about called Project Room Key, which allowed us to do all we could to stop the spread of COVID in the community for those experiencing homelessness, which certainly created a moment where we rushed and organized ourselves. And how we think about this plan going forward, given we are still in the moment of managing this pandemic, is certainly something that has impacted our work tremendously. I want to recognize, before I get into what Elisa called unveiling of the plan, that when I was just peeking at the participant list, it reminded me that what I'm about to share, because I want to just highlight what Santa Cruz County did for those who don't know this, or as a reminder, what we did, we being Human Services, Healthcare, the CIO's office, and a number of community partners. I saw a lot of names of people on this call who actually are doing the work, and I'm just very humble in the fact that I'm about to share a summary of what we have done in Santa Cruz County under COVID, but that's mostly because of the great and amazing work of a lot of people who are on this call. And I just want to thank you. I get the benefit of hearing about this weekly in a lot of meetings. So the first is people on this call might be aware that there are a number of hotels that were able to be leased very quickly when the pandemic started. And you may have heard of a program that's a state term called Project Room Key. And what that is just a combination of FEMA funding and then a state match, which is the Project Room Key, that makes it very reasonable for counties to find the funding to match and pull down that federal and state money. And when the pandemic hit, we have been able to stand up over a short time 6 hotels throughout the community that are most vulnerable, that need to be isolating or quarantining, who would otherwise be experiencing homelessness, to help them heal, be well, and not spread COVID. And we have over 200 people who are in those hotels. In addition, we have 15 existing shelters that had varying types of programs, many of which were not 24 hours a day. And there are almost 350 people who now have the benefit of being in those shelters. They've turned to 24/7, and they get things like food and staff and linkages to services that just really made this shelter system much more robust. And of course, all of it done in a social distancing way. And to do that, that required us to create some expanded shelters in order to spread people who were in shelters before or moved into shelters. And that includes that we opened the Santa Cruz City and the Watsonville City Veterans Halls, which together provides services to just over 100 people and have those same set of services. Further, we also focused on the transition age youth population, and just shy of 20 transition age youth were able to benefit from a very specific program that was up at the Seventh-day Adventist area and is in the process of being moved to community college. And then finally, we did do one managed encampment called the Benchlands, and that's right behind our 701 Ocean building, which at its height had about 100 people. And then finally, with a lot of recognition and thank you to the healthcare agency on this call, we took advantage of a lot of systems they have in place, and almost 300 people a month who are in various encampments and do not have the benefit of being in shelters are being served by healthcare and our agencies and their partners, who are going and putting hygiene centers in place, porta potties, hand washing stations, outreach supplies, water, Purell, food, tents, sleeping bags, and health wellness checks. So added up, I just want to recognize that, very quickly we were able to get our system stabilized and are serving well over 1,000 people a month in this, what we call sort of COVID shelter system. And this just sort of raised the question, what do we do when this federal and state money, if it does, gets pulled away, given we've been able to expand the system while we're about to launch this plan? And that is a question confronting many communities, including us in Santa Cruz. So I hope that backdrop was helpful, but I, again, want to repeat my recognition of all the people on the call and the great work in this community to be able to quickly do that. And I think that is represented in the numbers that we have not had much spread at all in this very vulnerable community, thanks to the work that I just listed. So with that said, Elisa, now I'll do what you call the unveiling for those who haven't seen this yet. So what's in front of you, this document will be or has been sent to you in the materials that was posted on the board website, so it's public information, is a draft plan. It's a framework, and the goal, which we'll share at the end of this presentation, is to sort of bring it back and close it and make it final in early 2021. But sort of what defines this 3-year framework is, first, it's organized under a set of guiding principles and a vision. And this is listed in detail in the plan, but the summary is it's actually intentionally actionable. It's not just a conceptual plan. It really moves to say, here's how we act upon and move these concepts forward. It is, as Elisa described in her introduction, intended to be countywide, cross-jurisdiction, representative of all interested stakeholders, that we're a team working together. Data-driven, as Elisa said, really trying to move from anecdotes in response to crises to sort of having better data systems, tracking data, reporting data, and also this overused word, not often well acted upon word of equity. Like, what does that mean? It's an easy word to say and sound like we're doing something important, but how do we actually make sure we're tracking demographic information and paying attention to whether or not different groups are being impacted worse or better, and what do we need to do about this throughout this 3-year plan if we're not serving any particular population well. It has a number of goals, which we will give a highlight of today, but they're detailed in, much more in the plan itself, with results and ways to measure success. Those are articulated through strategies and very specific objectives. And then I would say one of the first asks we have of you all on this call and all of the groups that we are presenting to is we are going to break up this work during this 3-year framework in 6-month work plans. And the reason is we need to break down the framework of the that is in the 3-year plan into very concrete 6-month work plans, and how and where we focus our work we want to do in partnership with the community to identify where to focus our work. So we're hoping that over the next few months we'll be in conversation with you about that. And then finally, building upon one of my introductory comments, a county and a city and a community alone cannot solve this. We need resources beyond our means. There are a number of variables that are not in county, city, or community control, so there's a number of assumptions. And in our efforts to become more transparent, we are trying to be very clear about what the resources we have are, what those needs are, and what some of the assumptions are, and talk about them and track them. So for example, if FEMA funding gets pulled out from us and COVID is still here, we lose 75 cents on the dollar for a lot of the services we're running. If that stays or if that goes is a big variable that will impact how robust our systems are to move this plan forward. So that said, Elisa, next one, this is sort of the high level. Well, what the heck are we trying to accomplish? We want to be humble and acknowledging during this 3-year plan. We are not trying to say we are end homelessness. How many of you have read or heard about plans that say by X date we're ending this challenge? We're trying to be pragmatic, if not a little ambitious. So the phrase unsheltered homeless versus overall is broken down in the words below, but we are trying to reduce unsheltered homelessness by 50% of the numbers we're dealing with today. And by unsheltered, that's basically all people experiencing homelessness, but for those who are in our shelter systems, because shelter is not a home, but it's different than unsheltered. And overall homelessness we're trying to reduce, which includes those who are in our shelter system, by 30%. So that's the big picture, what we're striving for in by 2024. Okay, well, here's where you start to begin to see where we are trying to break this down. And it organized into 2 core goals. And on the left, we are trying to improve the effectiveness basically of every type of program we run. And it's broken down in the chart at the bottom, like what that means, like people who get into programs and are stuck in those programs, not moving from those programs, not getting into housing, how long it takes to get into housing, et cetera. So that's all broken down as goal 1, to make sure we are more effective, we are tracking whether or not we are, and we're reporting on it. Number 2 is basically we are trying to expand our capacity so that we have more pathways to more types of housing, including shelter. And it actually breaks down and articulates what type of capacity we want to expand to. So that is detailed in the plan. So next one, Elisa. All right, so now I am going to queue up what I will call sort of the guts of our strategy. I'm going to frame the 4 areas that we are focused on, and then I'm going to turn it over to Elisa, who's going to break these down a little bit. And we hope that when we get into the open-ended question answer and during the next couple months while we're working together, we will work with you on how to make this work. So the 4 strategies. In the upper left corner, basically, we know there are way too many in this community who are experiencing some version of homelessness, and we want to better connect to those who are homeless, whether they're in shelters, they're in encampments, or they're whatever situation they're in, that we can enhance and better target the work that we do, engage people better, and have a better system. So that's addressing those who are currently homeless. Strategy 2 in the upper right corner, we know the solution is not entirely by creating more housing slots. There are some people who do not need new housing slots, but we can just better connect them to their existing networks and families perhaps. But we know part of the solution is we have to increase housing options. We have to have pathways to something. So we have a whole host of strategies to make sure we expand those housing slots of varying types. Strategy 3, the lower left corner, is basically prevention. We have a problem with more and more people becoming homeless. So if we just are looking at those who are homeless and trying to get them on better pathways to housing, but we don't focus on the number of people who are becoming homeless, and we need to name what's going on with the fires, the recession, and the challenges confronting our community and minis, we inevitably are going to have more people with housing insecurity and becoming homeless. So we have a whole set of strategies on prevention. And then finally, how do we do all this so that we're not just blowing with the wind and responding to problems and anecdotes and not having good data and not making good decisions? And that is having a better administration, having a better system in place. And part of the reason of our CAO, Carlos, deciding to transfer the administration in the county side of this from the CAO's office to the department I now manage is to make sure there was a more robust infrastructure to support the work, in addition to what the board approved of creating the director position that Robert has filled. And that is to make sure we have better systems that like data evaluation and abilities to manage contracts, and to our elected officials in the city and the county, that we have a better process between county and city, and that we have a better process between staff and elected officials in terms of how we make decisions. There are a lot of complex decisions and a lot of funding streams, and we want to be better organized and more transparent in front of the community and with our electeds so we can be rowing in the right direction. So with that said, I'm going to turn it over to Elisa, and she's going to break these 4 down a little bit more, and then it'll come back to me to close it out, I believe.
Hey everyone, so this first slide, as Randy said, is really around how do we better connect and serve people who are living in the shelter system or living outside. And it's also really where we sharpen our focus on encampments in terms of both in terms of outreach and engaging folks who are living outside, as well as the community impacts of encampments. It's also where I think we would see that capacity growth of increasing our shelter capacity by 150 beds. And we've sort of divided that between 130 individual and then 20 family. And so one of the things I want to talk about, though, as everyone knows, as Randy detailed, we're at an all-time high in the amount of shelter we have available right now. We don't have the financial capacity based on current resources to maintain that. And one of the things in our quantitative analysis and predictive modeling work with Focus was we looked at it, and then, like, for us to meet our goals, we have to be able to maintain at least 150 units of that additional capacity that we brought to the system in COVID. The way I think about it, that's 2 mid-sized navigation centers, COVID informed, of course, but that's a piece of this part. So this sub-strategy has 4 parts and 14 objectives. You're only seeing the sub-strategies here. The first 2 are really around COVID-inspired learning. The first one is around health and safety within our shelter system, and really maintaining this commitment to disease prevention and health across the shelter system. Many of you know, prior to our COVID experience, we did not have the interconnectedness across our existing and our new shelter system that we do today, based on the work just to make sure everyone had the right information. The second sub-strategy here is really the learning we've had around the effectiveness of truly low barrier shelter. And as that's what we've really moved forward with in the COVID response. We learned that many of the folks who are participating in programs today had not been really in touch with the system prior to this. And it's that low barrier 24/7 food, the right kind of supports, at least at a basic needs level, that are allowing people, that are inviting people to come and be part of that system. The next two sub-strategies, strategies 1.3 and 1.4, really started to look at our gaps. And these are things that we identified early in the interim recommendations, and many of you were in work groups on. 1.3 is really around increasing the robust set of services within shelter and making them available across the entire shelter system. So that's case management, that's housing navigation, that's connecting folks to benefits. This was something, the lack of that level of connectivity consistently across all the shelters was something that was articulated by providers and by clients as a need. So that's something that I think is a really important gap that we're actively working on closing. 1.4 is really that focus on people living outside in encampments, 7 objectives. One of the most important ones is really that housing focused outreach, and that we need to have more capacity for that kind of outreach, and countywide, that it links people to service, that you don't have to be in a shelter to get service and support. So that's a really important, we've identified the gap. We've worked with our outreach folks. We know we don't have enough, and we're not all on the same page, and this was a key one. And part of that is training staff to have deeper conversations about housing and barriers and how to help people, and to collect data on our outreach. The last piece there was really to work across jurisdictions and departments to develop shared approaches to encampments, particularly on public properties. So that's sort of the first large strategy area. Key partners in this are our providers, our cities, our county departments. So it's none of this, all of this takes all of us. It's not the county alone. It's going to take all of us, and hopefully more partners. Not just the folks who are part of the HAP, but across sectors, across systems. So that is strategy number 1. The next strategy is really, as Randy talked about, is really around supply. How do we, you don't solve homelessness if you can't get people housed. So the big thing is for us to reach those goals, those 3-year goals, which are doable. They're a stretch, but they're doable, is we need to have more housing supply. So the first sub-strategy is really about more units with a focus on extremely low income. And that's around utilizing all state, federal, philanthropic funds to do better and get to things like 100 units of permanent supportive housing within 3 years. Key goal to reach that reduction that we're looking at in overall homelessness. It's also to really work more collaboratively across jurisdictions and sectors, having an interagency housing pipeline group that really focuses on PSH and ELI housing, because we have a very significant gap. And as we look at our rates of homelessness, our ELI, a lack of sufficient, extremely low income housing it's a problem for folks who are unhoused, but folks who are marginally housed as well. Sub-strategy 2.2 has 3 objectives, and that's really trying to hone in and improve our rapid rehousing programs. And in that is adding 350 rapid rehousing units over the 3-year period. Sub-strategy 2.3, 3 objectives is really, again, it's that supply side, working with landlords and property managers. We have to have ongoing, consistent engagement and collaboration with the private market to really support people. And then the last sub-strategy with 4 objectives is really continuing to hone and develop the role of SmartPath in this system, and having sort of diversion and problem-solving conversations be the part of that intake in a SmartPath moment as we move this all forward. So partners here are county, cities, housing providers, developers, financing entities, the community welcoming affordable and PSH units, that we need a community that's going to support these housing developments across our larger county. So that is sub-strategy, or that's strategy 2. Strategy 3 is really coming back to that focus on prevention. And when we talk about this one, I want to just harken back to some of the statistics that we talked about at the beginning, that idea that 40% of folks in the last point in time count said that this was their first experience of being homeless. The other really important statistic which came through the work looking at our HMIS data was that about 60% of folks entering our shelter system came from a housed situation, that they were not coming in from living outside. They were falling into the shelter system from being housed. So this is really that question of prevention. How do we, one, help people from not having to enter the shelter system in the first place and have much more upfront work on diversion and problem solving before people fall out of their housing situations. And so that is one of there's 3 objectives in the sub-strategy 3.1, focusing on diversion, problem solving, whatever we want to call it, and really making that be part of our system and resolving their sort of housing insecurity issues, using flex funds to keep people housed. The second sub-strategy there is, and there's 5 objectives, and that's really coming up with a more systematic, analytical way to target prevention. Who are those folks that are engaged in maybe different parts of the safety net system who we know from data are at higher risk, and how do we get to them sooner? And that may be, you know, some different kinds of partnerships with County Office of Education, a whole bunch of players to come around and say, how do we stop the inflow? As we all know, prevention is going to be way more cost effective than dealing with it after the fact. Partners here are community providers, volunteers, county safety net programs. Again, this is not a county thing, it's an all of us thing. Which then brings us to that improved administration. This is a lot of work. It's going to take a lot for us to do this, and for us to really get there, we need to have that administrative backbone to do it. The first strategy, and this is one we've been talking about in this community for a very long time, is around decision making and a new approach to governance. So that is one of the things that we will have to do to really make sure our resources and our priorities are shared and actionable. The second piece is strategy, or sub-strategy 4.2. It's really about authentically and meaningfully including the voice of folks who have been homeless, who are homeless, and our design of programs, and are looking at systems, of looking at data. So having that consumer view inform what we do. And there are, I think there's 7 objectives around this one. There's a lot in here on this one. Strategy 4.3 is staffing the new division. That while they're not going to, we need that backbone organization to be strong to support the data collection, the coordination, the communication across partners, so we can do this lift. And I think one of the things that's highlighted in this sub-strategy, and Randy talked about it, is that use of 6-month work programs. And I want to give credit where credit is due. That came out of the project advisory group, as we recognized through our COVID experience that things are incredibly fluid right now. The idea of a 3-year work program, when we don't know what funding is, we don't know where our housing market is, that we needed to take this in shorter chunks and be very, very clear and collaborative, and do it in a way so we can be accountable and measure. So that's an important piece that we highlight as part of the action plan in this piece. The last one is really around data. We've talked a lot about it, and it's that we use data everywhere, and we support our providers with technical assistance so they can effectively collect and use data. We use it as a system to drive continuous improvement. So it's both an operational focus, but then we also have appropriate dashboards to communicate the work publicly. I think all of us know we do a lot of stuff and people don't know what's happening. So that's the other piece around that that strategy, our commitment to using data effectively. Whew. Okay, so with that, I'm going to hand it back to Mr. Morris.
Okay, well then I'll say thank you, Ms. Benson. This is that moment that if we were all sitting in a room and Elise and I were at a table up front, we'd probably do something fun like ask everybody to stand up and stretch or something, because this is a lot of information. But hopefully you're hanging in there. We're getting close to the end, and then we'll open up to have a conversation. I mentioned this in my introduction, kind of some of the underpinnings of this plan, that there are some assumptions in here that we sort of want to just name. I think part of what we want to do a better job of as government is being transparent and holding ourselves accountable for what's in our wheelhouse and our responsibility, but also just naming and seeing if we have consensus with our community and city partners about things that aren't in our control that will have an impact on us, and just talk about it. So the first is clearly things like fires, and now we're preparing for debris flow and mudslides, the pandemic, the recession that followed, this, hopefully never again, but very complicated presidential election and transition that will or won't happen. I mean, what is all of this going to do on the housing market, particularly for people who are low income or extremely low income, is a huge question mark that has a major role in what is going to play out over these next 3 years. And county government alone doesn't control these variables. Related state and federal resources. For those on this call who don't know county human services government, and this is very similar for county health government, about 90% of our funding is federal and state with small local matches. And so when you are that heavily leveraged, it's not quite an apple to apple for homeless services, but a lot of our funding is state and federal, particularly during this pandemic. So will those levels stay? Will they increase, or will they be cut? Are variables not in our control, but have a big influence. Elisa mentioned the Housing for Health division getting sufficient resources. I do want to take this moment to recognize Elisa, Tatiana, and Rainey, who are a mighty team of Rainey as one, and then Rainey and Elisa when Elisa started a few years ago, and then Tatiana was added, and as a new human services director with a department of 500 people, and now we're going to have a team of about 7, I can already feel that we need a lot more. So recognition to Tatiana, Rainey, and Elisa holding this for a long time. And we could, we'll do better with more, but we need to balance that with putting as much of the resources we have towards direct service. And that's always a balancing act. Partners prioritizing available funding. Does that sound like a good political government phrase? Code word for. There are government agencies and non-government agencies who receive funding in the world of housing that have choices to make. And sometimes those choices manifest in the form of adding housing not to those who are lowest income, extremely low income, or to help create housing for those who are homeless. They go to other needing groups in need, and we can't control that, but we can have those conversations, and somewhat that's a community decision. But we want to recognize that when funding streams come in that aren't ours directly, we are impacted positively or negatively on some of these goals we have, depending on other partners' decisions. Capacity of our housing developers and service providers. I know there are some on this call who are in the middle of this and could speak better to what it's like to be in these lanes, but they have a very tough road to hoe and a lot of work to do, and their capacity is a factor for us. We want to support our partners. And then to wind down, elected officials, community stakeholders, how are conversations going to happen that often play out in planning commissions at the city and county level, when this very, very vexing, complicated issue of siting and does the community want to have housing built for people experiencing homelessness or very low income is a very complex and vexing issue. And that's going to take a lot of work for cities and counties, not just in Santa Cruz County, but elsewhere, to be part of the solution or to continue to not be able to move these things forward. And I say that with humility and no judgment. It's a complicated issue that's very political, involves lots of community dialogue. And then the last one is the kumbaya statement. We end up too often in moments like this, when the crisis is this large, spending energy pointing fingers at who's not doing their job or who caused the problem, instead of getting in the same lane and putting our energies towards moving the needle forward. Easier said than done. But this, good. No, Lisa, that was perfect. Go back. That was perfect. You cued it exactly. So that leads to the actual visual of, you know, we all want to get in the rowboat and row the right direction. And this is just like a nice picture that summarizes, you know, there's a lot of stuff we need to do to expand our capacity, improve daring efforts. But to do it, we really need partnership. And again, I think that we as county, with the privilege we have of the money that flows through us and others, have a high responsibility to be a good partner to you. But in exchange, we just want to figure out ways to improve partnerships with city and community throughout the 3-year plan. And that's why the picture's there. I think, Elisa, that moves us to the closeout slide. Do you want me to take it, or you got this? I'm going. Next steps. This is it, everybody. We're almost there. I think we go to the next one. So what are the next steps? So we are in a window of the month of November, December, and perhaps early January from some I dotting and T crossing, where we want to work with you to review the framework, have conversations like we are having today. We are specifically interested in having your assistance figuring out how to prioritize what we should be doing in the first 6 months, because we have 3 years and we're going to have some choices to make where to prioritize. And we'd like to do that together so that when we get back to our county board and the city councils, that what we bring forward to sort of officially launch this in early 21 is representative of feedback from all of our partners. And so that leads to, I said it was the last slide, but actually this is the last slide. So Elisa and I did a co-presentation like this to the Board of Supervisors on the morning of November 10th. And then we have proceeded to have some presentations to now 3 of the 4 city councils, and we have the last one tonight at Scotts Valley. We also have some of the board members having town halls. Supervisor Caput has one on Thursday evening. Elisa and I just got invited to present at Supervisor Friends. So we're going to probably have a few of these coming up. And during November, December, you will be in receipt of an online survey that's going to be sent out, inviting people to respond on a Survey Monkey. We have another set of strategies where we are going to, in the world of pandemic and social distancing, mindful, we're on Surge 3, engaging people with lived experience to get their perspective. And then this is one of those, you're called the HAP Plus group, right in the middle there. We're having some of these virtual meetings thanks to Focus Strategies and others. And then the goal is to come back, as I said, to our elected officials at county and city with what we hope is then the final plan, a little more aesthetically pleasing, a few more graphics, I's dotted, T's crossed, and the first 6-month work plan. And then that will be what guides our work. And that will include identification of who's doing what. And we hope some of you would be willing to sign up to be members of the who's doing what in that 6-month plan. So, Elisa, I think we are ready to move to the discussion.
Actually, I think that's back to me. So thank you both so much for the presentation. We are going to open it up now. We have actually a good chunk of time left on the call, on the meeting. So I just wanted to frame a little bit of what we're asking folks to do. As Randy mentioned in the that last slide there. One of our main objectives with these sessions is to make sure people get their questions answered. So we encourage you to ask questions that you have. If you have a comment or just some input you want to provide about your opinions and thoughts about the framework, you're welcome to share those as well. We are going to try, depending on how the timing works out, we're going to try and prioritize answering people's questions. As Randy mentioned, there is going to be an online survey available to fill out. It will be posted on a web page that you'll get a link to, and also you'll get the actual, the web page will also host the document that is the framework. So there is an actual document. If you really can't wait to read it, it was in the board packet when it was presented to the board back on November 10th. So if you want to go back and find the board packet, you can find the actual framework document. It is also going to be hosted on the HAP webpage shortly. So with that, I think we're going to invite folks, if you would like to ask your question out loud, you can raise your hand using the raise hand function, and Rainey is going to call on people in order so that we can have you unmute yourself as you go along. And then we also will be answering the questions in the chat, and we do have a couple already. So my suggestion is actually maybe I'll ask a couple of the chat questions, and then we'll go to the raised hands and we'll go back and forth. So don't feel like you have to raise your hand or you have to use the chat. You can use either. So the first question that came up in the chat was from Joseph Jacobs, asking about the first strategy area around connecting and serving people who are in shelters or who are living outside, around the care management reference, and wondering if that was really supposed to say case management. So I just wanted to see, I think that might be a good one for Randy to answer. Anyway, to talk maybe a little bit about the care management and what we mean by that.
Kate, I'm looking for the question again. It's in the chat itself.
Yes, it just says strategy 1.3. Is that supposed to read case management instead of care management?
Well, I'll answer it broadly, recognizing a number of people on this call are working on this, and we've secured some funding that we're actually in the process of purposing to have, whether it's care management or case management. There are people who we have engaged now in the COVID shelter system, via the shelters or the hotels. There are people in encampments that we talk to, and it's very clear we need to have some capacity to work closely with that person to be able to help them get on a pathway to housing. So on a very, very high level, I think the statement is yes, just having a pathway but not having somebody to help work with that person to navigate the system is a problem, and we're trying to build that bridge, and we have some money to do so. That's my high level statement, but there's more details behind that with numbers, and we're about to go online hopefully in early 2020 with the launch of some expanded case management. And I also do want to recognize we already do this here and there in some categorically funded programs in human services and in health services, and some of our community partners do it. The issue is making it more robust and organizing it better. But Kate, I still can't find where the question is. I'm scrolling through the chat.
I'll just add one other thing. And we know that some of our providers within the homeless system are doing it right now. So it's not like this is totally absent. Some folks are doing it. We're not all doing it consistently. And so that's the other part of this work, is this idea of how do you have a community of practice around this, sharing what works, what doesn't, having standards. Again, that idea that we should be doing, if there's best practice, we should be doing it everywhere and not by accident.
And Kate,
and Randy, I don't, if you want to find it in the chat, if you go back to timestamp 1:42 p.m., you'll see that question.
Yeah, I want to just recognize what tripped me up is I recognized Joseph had that question, but I was actually reading what else he said, which I would like to underline and recognize and affirm is a profound issue. And that gets to the prevention strategy, and that there are a growing number of people across the country, and this community included, who are a paycheck away from entering the numbers of homeless. And so care management, case management, whatever it is, anything we can do to stop the flow of people becoming housing unstable. And that can include care management, case management. So that's what I was reading, and I wasn't tracking, but that he had a question above that, which I think I high level answered.
Great. Okay, so I'm going to just read out one other question that's in the chat from someone who's been patiently waiting, which is from D, who's asking about the percentage of people who come from housing. And I believe this is in regards to the diversion and prevention part of the slide of the presentation, Elisa, where you were talking about through some of the analytic work we've done, Focus Strategies has done, we identified that you have some percentage of folks who are entering your programs who are actually either in their own unit, or they're staying temporarily with friends and family, or they're in other kinds of house situations. The actual percent, is it okay if I just answer this?
Yeah, please.
This is sort of more of an analytic question. So the percentages are different for different project types, so I don't really want to go into the actual numbers, but I think the concept I just wanted to articulate is one of these performance measures that is now in the plan, and that the whole system is going to be looking at over the next 3 years and looking to improve, is what is the rate at which people who are unsheltered, or meaning living outside, or are in shelter are then getting to your housing resources. So you really want to prioritize the interventions you have in your system for people who are outside, if you have a lot of people who are living outside, which you do. So that's the measure, is about looking at what percentage of people are unsheltered versus what percentage of people are housed that enter your programs. And if you'd like to see all the detailed analysis about that, it is in the series of reports that we produced as part of this engagement, which are also going to be posted, if they're not already, on the website along with the framework.
Thank you, Kate. And we do have a hand raised. Sibley Simon, please go ahead.
Sure, thanks. This is super exciting. I'm really glad we're here. Look forward to being part of going forward. I was surprised that one of the gaps identified was not included in the gaps was our inadequate housing supply, which I think underpins a lot of this. So I wanted to, encourage that to be added. But my question is, I saw that the goal for permanent supportive housing creation was 100 units. And, there's more than that under development right now. So I was curious, was that meant to be like in addition to projects that are, currently moving forward, or, and just how that number was arrived at?
Hey, Elisa, how about you answer the question and I'll respond to a statement at the beginning, because I'm the one who probably did not articulate clearly that of the 4 strategies, the second one I articulated is the issue you named. There is not enough affordable housing, period. So my bad if I didn't make that more clear, that is one of the 4 main strategies, and it's a recognition that we are a community, not the only one, that don't have enough affordable housing. So just want to confirm that. And then Elisa, the question was about what's in queue, I think.
So I might need to lean on Kate or Catherine a little bit in terms of the modeling, but the modeling work did not take into account the units sort of in the pipeline at this point. So quite frankly, Sibley, we can meet this goal if the stuff in the pipeline are realized. We can meet and surpass it. So one piece of input that we could hear from community is 100 is too low. We should be setting ours now. That's within 3 years. So I think that's an element for discussion. I think the second piece that you were talking about, and actually, if you want to know more about how it was done, I'm going to have to say, Kate, Catherine, talk about the predictive modeling and how it involved our current HIC and all that kind of stuff. In terms of what I think the other implication of your question around, we know a gap in ELI housing, but we don't have a goal. That's something we actually got a piece of feedback before we went to print about that too. And I think that's something, if we hear from the communities, there's nothing there about housing production, outside of PSH. And we should have, if we want to have an interjurisdictional, intersector group around that, it probably would be helpful to have a target around ELI production. So I think that's space that we want to hear from people about.
There are
no other hands raised right now, so I would
so
go to questions in the chat.
I have a couple more questions in the chat. So Christine Suchil is asking, why is there no specific breakdown in inclusion of the CZU fire emergency and the program shelters developed? There was so much collaboration and mutual aid system sharing, but I've seen very little acknowledgement of that impact, particularly the homeless living or camping in that region.
I'm not quite sure what the question is, and is the question around addressing CZU homelessness, or
I don't know. Maybe Christy could unmute and
please
clarify if you're there.
If I'll just say a comment, if Christy left or can't unmute, I did do a breakdown of the impact of the pandemic and detailed what happened to the programs and shelters that we developed when we lifted up the programming in March and April and May. I think what's behind that is then there's the CZU fire emergency, and it is correct, if this is what the statement is, that this plan was almost done when the fires hit. We managed the fires and then we dotted I's and crossed T's, and it's correct that we didn't integrate into this other than in just talking points that there was 1,000 family homes lost. And the impact of that, we're just making a generic comment, but it is correct. It didn't get folded into the modeling and the reference. And there has been a tremendous amount of work done. And I think we are down to about 100 people who are in FEMA sponsored hotels from the original, we had over 1,000. So we do have an impact, and it is correct. If that's the question, that it's not named in this model, but it's a confounding variable that's adding to the challenge that people have lost their homes.
All right, well, let's move on. And I actually think, so this next question actually was sent not to the whole group, but I'm just gonna ask it. So this person is asking, is referencing the actual framework document that it talks about working to clarify appropriate collaborative responses to public encampments, and wanted to know if we could talk a little bit more about what that expression means, or what are we talking about when we talk about collaborative responses to public encampments.
Well, there's a lot to explore there, because there's lots of different thinking around different jurisdictional responses to encampments. And right now, every jurisdiction handles their response differently. And so part of it is just starting that conversation to say, given we don't have enough shelter, what is reasonable? So I think that's part of it, is just a commitment to those conversations. I think people are aware different jurisdictions have guidelines around, when and if you enforce on an encampment. Right now, we've been, pretty, well, from a public health standpoint, our guidance is you don't. But I think there are also implications of encampments for a broader community that also have to be folded into the conversation. So this is more a commitment as part of the plan that jurisdictions need to come together to talk about this challenge. And I mean it in every direction you can define challenge. Because right now there is no shared vision around it. There's no shared implementation. There's a lot of opportunity for conversation.
And if I can say a touch more in the interest of being really transparent about some of the complexity of this, and just recognizing that depending on the seat you're in, you have a different view of this issue of encampments. And so dealing with much of this country and having fire risk, there's a new dynamic playing out over the last 5 years, which is when there are encampments anywhere in the country that are in fire zones, and your fire, you have one view on what to do with that encampment. If you're law enforcement, you have a different view. But I want to throw out there that COVID has created this unusual new tension. And Elisa mentioned it, but I just want to say a touch more. The federal government, say whatever you want to say about CDC and the current presidential administration and what information is getting out there. The guidelines from the federal government under COVID is to not disrupt encampments at the risk of spreading COVID, which rubs against a lot of issues. And our funding under COVID is not to disrupt encampments. And I mentioned in my presentation a lot of work that's being done by health and partners to help do wellness checks and help make sure people have sanitation, which is very, very different and at odds and creates a tension with a different perspective about, what an encampment looks like or concern. So just want to underline what Elisa said, that this is a vexing issue with no real good solutions. And there's many perspectives. And the challenge is the number of people living in encampments is significantly larger than the resources the system exists. So there's also a resource tension about where you put your energy towards trying to do something with an encampment. And if you move it from here and you don't have it there, then they just end up there. So it's a very complex issue.
Great. So I think Rainey's going to call in a couple of hands, and then there are still a couple more questions in the chat that we will get back to, but we're going to let people who are raising their hands go next. So go ahead, Rainey.
Thank you. Yes, Greg Pepping has his hand raised. Please go ahead, Greg.
Yeah, thanks, Rainey. I was in the queue when that last question was being addressed. So this might be, well, I don't think it's repetitive, but I guess I appreciate the attention on people experiencing homelessness, and with the focus of this grand document being housing. First of all, congratulations and well done, and thank you. But with the focus on housing, some of the recent comments were like, what do we do until everyone's housed? And for people not working on, professionally, for people not working on that issue, what they say in the community is a lot of impact on, their daily lives. And some of them honor the dignity of people experiencing homelessness and some of them don't. But with that said, if this isn't a document that talks about what we're going to do for community impacts, then people need to be directed to another place where that is. So, Elisa had said there's a lot of opportunity for conversation. I guess then I would encourage that this document have statements about what it is and what it isn't. Even before COVID, there was a lot of confusion from one jurisdiction to the next. Like in a city park, for example, that's incorporated area. So is that PD? Well, PD acknowledges they don't have solutions to homelessness. There's confusion around case law, and that was before COVID. So I just encourage you to have, there's mention of a new governance structure, and then improved strategy for communication with the community. I just encourage you to say what's going to be done with regard to impacts for the community, or point people in another direction and let them know that that's not missed in this. It's not supposed to be in here. Hopefully that makes sense.
And I think I know where you're heading, Greg. I think one, we have to identify what are the impacts, because like you said, there's it makes me uncomfortable to see homeless people, or there is no, it's affecting this other community asset. And so, and from my perspective, it's a place of conversation, because we work in these vague terms, and we need to get real with each other. So, is this going to speak to that? No, it's going to say we need to start talking about it. We need to figure out who wants to be at the table to have that conversation. So, that what I would say is I don't know that we have an explicit objective around let's talk about community impacts, but maybe that's what you're getting at.
Yeah, I encourage you to the community. Again, the focus is on people. The focus ought to be on housing for people experiencing homelessness. And the rest of the community is who puts pressure on elected officials and all of you working hard, because not enough is being done. Even if we achieve all these successes, people are going to feel the impacts in their daily lives until these goals are met. So let's talk about, let's answer those questions. They're about who's in charge in a given area, and what clarity there is, and what we don't know, and what we do know is with regard to jurisdiction and case law. And until everybody's housed, what do we do?
Kate, Brent Adams has had his physical hand raised and put something in the chat. I just want to say one more thing, Greg, if that name is written properly in your name there. I just want to confirm, I think I hear what you're saying, and that is these administrative efforts to move the needle in the right direction are very, very often have no change in visibility to the issues that are of concern, whether it be a compassionate concern about the struggles of someone experiencing homelessness, or I don't like this in my view, or it's ruining my experience going downtown to eat dinner. Whatever the issue is, all these things are happening. I think I'm hearing you say but there's a whole bunch of people who don't see change even if you do make change. And if I heard that right, my takeaway is somehow that needs to be named and part of the dialogue as we roll this forward. So it's not separate, or we name it as separate.
Okay. I think we have a couple people have had their hands up for a little while, and I just want to make sure folks who are waiting for their chat question to be answered, we will get to you. But Rainey, did you want to call on a couple people who've been waiting?
Yeah, and also just to remind folks to use the electronic hand on your screen, because I cannot see everybody's pictures. So there is a raise hand function. If you could use that, that would really help a lot. Dee is waiting to speak. Go ahead, Dee.
Hi, I just really wanted to follow up with what Greg just said, is that over and over again, I watched not being acted on because of public reaction, you know, the old not in my backyard thing. And I'm struck too by how addressing this is a framework. I'm just a regular citizen. I lean totally left, but I guess I've been doing just some research of my own, looking at what they're doing in Seattle and other places, and you know what the public perceives and how the homeless, particularly drug dependent homeless, the effect it has on public perception should be a huge part of how you're approaching this. Because I think that if solutions address directly, you know, the unpleasant parts of it, not the people that have lost their jobs and all those other things, but people that are using needles and all that stuff. If that is addressed somehow, and I'm not saying I have the answer, although I do have a suggestion. I think all of this isn't going to get on board the public support and funding, possible funding that you're looking for. And one of the things, I'm sure you've all seen it, but the Seattle movie, I can't even remember the name of it, but what they did is they used their funds to build a large, it's not exactly a jail, but it's for people that are using drugs and being inappropriate in use of public space, and that they're put into these. It's not, they're not treated like a prison, because obviously that does not work, but they're given access to help, access to care, case management. And you know, one of the things I was impressed by in the movie was that so many people, when interviewed, said they'd be dead by now if they hadn't been put in a place where they were able to be targeted for help. And I'm just seeing, I mean, I've lived here for 40 years, and I've just seen over and over again this revolving population. And I mean, as a citizen, I don't really like people hanging out around Ross using needles and all that stuff. And I think there's a lot of people like me, but I'm here because, you know, I want to help the homeless. But I just think that public perception, and people want to know, what are you doing to solve this? You know, not just house it. Although I totally understand, I've done the research. Housing is absolutely #1 for chronic cases. But I don't know. I don't know if I'm being clear, but I just think you're going to get faster to where you want to be if the public's behind you. And that should be part of the framework, is looking at what that is. What would make the public feel.
That's a great point about the public buy-in, I think.
Thank you for that. And then we also have Serge Cagno had his hand up next. Thank you.
Hey, thanks for the presentation again. Amazing amount of work from a lot of people that went into putting this thing together. My thing, I think it's on advocacy, but it's also on best practices. and I'm looking mostly at the outreach and the shelters, but also on the care management. I don't see a consistent looking at the demographics of those that are falling through the cracks. I see on 1.3C, tracking people going to housing and also looking at racial and ethnic disparities. But that seems to be the only place that the specifics of those not succeeding is being looked at. It seems to me that for the specifics on outreach on those that are hard to reach, I see that it says implement best practices in 1.1D, and I see that it says in 1.2 to 1.2C unnecessary cause terminations and bans limiting those, but I don't really see the actual looking at what the numbers are of people that are falling through the cracks. That kind of analysis will show you whether the changes, whether you actually are removing barriers. So just that point of where things can continue to be improved and where we can still grow in this effort seems to be something for me. But absolutely, I love all of you guys and I love the work.
Thanks, Serge. I don't know if anyone else wants to respond. I did want to say, I think some of this further drilling down on measures and what you're going to measure and how you're going to do it is really for those 6-month work plan cycles. And so, just because something's in the framework at a high level doesn't mean it isn't going to get, further drilled down upon. And there's a really strong emphasis in the framework about being data informed across all the different aspects of the system. So I think what you're bringing up will get tackled, but I would defer to the H4H group on that.
Well, I just want to make a comment, and Serge, I think you were the one who wrote a public comment through the web when Elise and I presented, and I recognize your 2 shout outs. Thank you. It doesn't hurt to help us, because we know we fall short because this is such a big issue. But one of the things we are going to, because we have to put in the first 6-month work plan, is to get our data system better. So I just want to be really transparent and honest in terms of expectation setting, that we have a lot of work to do sort of behind the curtain of government to get a stronger data system, so that during hopefully the second 6-month plan, we have strong reporting systems with reliable data. And I think back to your comment, Serge, I think whether the words were missing, even where the words are in place, it's going to take us a little time to get our rhythm, that then we can have recurring reports. Hopefully the reports are on websites. I'm sure the board and city councils will pull us up for public meetings, and we would like to hold meetings like this again and be really transparent with what the data is. But I just wanted to name, we do have some work to do to get the data system in place so that we can track and report. So that'll be a key part of our first 6-month plan.
Okay, I think I'm going to go back to a couple of the chat questions. Rainey, unless...
We do have Brent Adams who has asked to speak.
Okay.
You can either take another question from the chat and then Brent, or
No, let's go ahead. Brent has been waiting a while, I think. So
okay.
Let's do that, and then we'll go to the chat.
Go ahead.
Thanks, everybody. I'm not in any big hurry, but I do. I wish there's more opportunity for a nonprofit like ours to be involved in that earlier process, but we are far outside of this paradigm. So granted, and I do appreciate the move always towards housing for homelessness. That's extremely important. But what we're talking about authentically is people who sleep outside, and with this much energy on that side of the pie graph, I don't see nearly enough for when we talk about encampments. That's where homelessness actually lives. Needs oriented. Where's the discussion of hypothermia shelter? That we do a warming center. The county did help us with one in Watsonville. We had 50 people anytime we opened up. That has been removed. We really need to talk about the basic needs of people suffering, sleeping outside. And I know this is just my one opportunity to say these words, so I thank you for this opportunity, and I'll be brief. A warming center is something that the county and the city should be committed to supporting, reducing that experience of hypothermia for everybody who sleeps outside. When I say everybody, we fling the doors open. It's not budget oriented, it's needs oriented. And we found a way to do that. Scalability is something we need to be talking about when we're talking about the broad number of people outside left out of this paradigm we're focusing on here. Of course, let's remind ourselves about the grand jury report and the scathing critique of the process up to this point, HMIS, permanent supported housing, just that lack of support that we've seen. So I really like a doubling down on these issues. And yet, let's be clear-eyed. Often local governments never admit fault or apologize. We just keep moving forward with the ball like this. And I'm just here to reflect basic needs like our nonprofit is offering: storage for every single person who sleeps outside, laundry for every person who sleeps outside, electrical charging, donations, and thanks for AFC for showers. But what about this unmanaged camp concept? This is what we want to see, a more holistic view, bring the tribes together to talk about it. We've seen this beautiful managed camp in the benchlands cost so much money, though, when the conversation of transitional encampments has been left behind. We saw a comparison of these unmanaged camps with the managed camp. That's apples and oranges. We need to have a more thoughtful, engaged conversation community-wide around transitional encampments. Why are they so successful in Eugene? Why does the city of Eugene advocate for them so much so that nonprofits can? So it's a certification process that a nonprofit or a church group or even a community group would be certified by the city or county to operate such an encampment. It's far less. It's 10% of what this current one has been costing us, and the data shows it's far more successful. Anyway, I really appreciate the opportunity to say those few things. Please look up warmingcenterprogram.com. Reach out to me if you want to engage in these conversations at all. Thank you very much.
I do want to jump in and there was a lot said there, Brent. I do want to recognize that of the 4 strategies that were listed that are the guts of the 3-year plan, number one is better engaging those who are experiencing homelessness with a whole host of strategies. So our bad if we didn't name front and center more clearly that this just isn't about stopping people becoming homelessness or just having pathways to homelessness, but better serving those who are. And then to your comment about government not apologizing, I just want to briefly say, by way of introduction, having worked in government for 25 years, something I never thought I would do, and now I am government and I'm in that seat. I've worked in a lot of safety net programs, and one thing I think we don't do a good enough job doing is explaining and educating to the community in a clear way the situation you're in when you're county government compared to city government, compared to state government, compared to federal government, because it's a complicated puzzle and people just see a problem and they don't know where to point the finger. So if we can do a better job in this 3-year plan, being really clear and transparent with everybody how much money we have, and we get to a point where we sort of together pick and choose where to put resources, because I will tell you, even with the federal and state money that we have today, there is not enough money to do everything in this plan. So we have choices to make. And it kind of raises an interesting question, like, well, then who's at fault if a community chooses to put all its resources here and not there? And when people are complaining about not there, is that county government, or is that because we just didn't do a good job having a conversation with the community about why we picked something? Because we're in a resource short environment. So that's part of what we're hoping to get to during this plan, is that it's more clear to everybody what resources we have, where we've applied those resources, and what we're doing to get more resources, because we're always going to be in a position at county and city levels of not having enough. So I think the criticism is good. The question is, where's the fault? I think we should keep talking about that.
All right, thank you. I am going to go back to the chat questions, and I actually also want to make sure and ask if there's anyone on the interpretation channel listening on in Spanish. If you have questions, you can type them in the chat box in Spanish. You can also raise your hand and we can have questions interpreted too. So just to make sure and see if anyone I don't know if there's anyone on that channel right now, but if you are, you're welcome to ask questions.
And Kate, after you take the next chat question, we do have someone with their hand raised.
Okay, great. So I'm actually gonna, so a few people have typed in just comments and things that they think it would be good for us to think about doing, but are not actually questions. So I'm gonna skip to the things that are people asking for answers. And then if we have time, we'll circle back to the comments. So one of them, which I think is probably a quick answer, is, are there plans to provide sanitation and waste management services for unsheltered residents in the plan? Currently, unsanctioned camps are without these services. It seems that responsibility is being hot potatoed by the city, county, and state. There are objectives in the plan around health services for encampments, but I don't know the specific answer to this question, or if anyone wants to field this one.
So Kate, the question being specific commitment to providing services at unsanctioned encampments? Correct. That's not included in the plan currently. I think quite frankly, there's significant differences of opinions on that. And that's really comes down to some of the politics around it. And some of the issues that Greg talked about as well. So it's one of the hot potatoes. I'll just describe it as that. And while I think there was a much higher, we did a lot of that as part of our COVID response. The question is, how do we continue something like that in the face of community response? That these are where the hard conversations have to happen. The plan doesn't answer all those hard questions. It talks about what are the things we need to answer together to meet the performance, the outcomes for people who are experiencing homelessness that we agree to meet. So that's the intention of the plan, is to provide a framework, and part of the whole new division, and hopefully all our jurisdictional partners and intersector partners coming together, that we will start having those hard conversations. It's not 5 staff's decision to make that call. It's something as a community we need to wrap our heads around.
Okay. The next question is more about a clarification about the targets. So this question is about the goal of reducing unsheltered homelessness by 50% and total homelessness by 30% by 2024. Is this a reduction of that amount from the 2019 PIT count? And the answer to that is yes. So the baseline we're working off of for meeting these population reduction goals is 2019. And that's how they'll be measuring it. Anyone else want to say anything about that? And then just kind of a related comment is, for the sake of transparency, the plan should really say what is the total amount of people who will still be experiencing homelessness once we've reduced by 50% and 30%. And actually those numbers are in the full plan, I believe. Okay. So this is a little bit of a question and a little bit of a comment, but it's a topic that hasn't come up yet. And this is a question about whether there's been consideration to prioritize housing for women with and without children, given the high rates of sexual assault for this population.
I'm going to make a comment about process and communication and dialogue with this community, which hopefully doesn't sound too political and evasive. I think there are a number of subpopulations that are deserving of very righteous attention. And I think it would be very helpful to have that conversation throughout this 3-year plan. Because sometimes funding is generic and it gets played out generic, and certain populations don't get served well. And sometimes when you choose a particular population, by choosing one population, that means you're not choosing another. And I think it would be better if we could work on that conversation together. So I will say to whoever asked that question, that has come up in internal conversations as we are looking at purposing new activities, new program because of that very reason. And there are other populations that get named as well. So those are Solomon choices that we hope to make together because they're not easy ones.
Kate, I think there's another comment. This has been it's coming up in the chat and it's come up in some other forums, a question of not having winter shelter. About a year and a half ago, we moved to year-round shelter. So we went from only having emergency shelter during part of the year to having it year-round. So that's when people say we don't have winter shelter, it's because we have year-round shelter now. Now, do we need more? Probably. We've identified, we need at least 150 units more. But so when people talk about that, I think it's an interesting, you have to put it into the context of what's changed in the environment. We've now moved to offering shelter year round. So, and then you add on the COVID shelter response, which, we know is a limited deal. We actually have more shelter now than we've ever had before in this community. And it's still not enough, right? We look around, great, we have more, but we still have an incredible, number of people who are not getting served.
Okay, I think
We do have a hand raised if we've finished the chat box question.
why don't you go ahead and do that, and I'll go through the chat and make sure I didn't miss any questions that are actual questions.
Okay, great. Kelly Archer, go ahead, please.
Hi, everyone. Thanks for having this forum. I'm moved to Santa Cruz 2 years ago, but I'm still learning a lot about how this all works. I grew up in Orange County, and I grew up struggling with homelessness. My parents were both addicted to meth for like 10 years, and it broke apart our family, and I was pretty close to getting into foster care, but thankfully I avoided it and stayed with friends and friends. So I have experience in this, and I'm really trying to see how my personal experience can help figure out solutions. I was able to go to college and go to school, and that's what brought me here. I work as a civil and environmental engineer, and so that comment about sanitation really is special to me because I design wastewater treatment systems for people all the time. But like the fact that we have people that have to use the bathroom and go and use bags and throw away their own feces is like really sad. And so it's a humanitarian aid crisis going on, and like it does impact our watershed. So it's really cool to see the Coastal Watershed Council here. And so I just want to appreciate an effort to focus on basic needs because we can't build enough housing anytime soon. And so like, how do we serve folks struggling now? Where do they get their drinking water? Where can they go to the bathroom in a dignified way? Like all these things are so essential to the day-to-day. And it's, I think, something we should focus on moving forward. And again, I'm learning I don't know anything about like the politics funding. I'm still learning it all, but those are things that are important. Those are things that are important to me. And yeah, I wish there was more support for the Warming Center. So I'm just going to give them a shout out. I think that organization in Brent works his ass off to provide anyone and everyone like basic needs, and they don't have enough support to do all the demand that's out there. So those are my 2 cents.
Thank you. A couple people have reminded me that I missed a question way back at the 2 o'clock mark, which is about, because it's kind of a question and kind of a suggestion. What about investing in pallet housing transitional communities such have been established throughout California and Oregon? Large ones, hundreds of beds with community centers, transportation caseworkers, et cetera. For example, Santa Rosa, Sacramento, San Diego, Los Angeles. Thank you. And a few other people have asked about pallet housing.
Great it's a thing that's being rolled out. It's actually from my old hometown, Seattle. But I think all of it does come down to sites, services, and dollars. And it's not permanent housing. So it is something we can do. And it's about, you know, where and how we focus. We already have actually, in partnership with Housing Matters, we have 40 pallet shelters at their campus. It's something I think we sort of, you know, inside the county team have talked about more expanding it, particularly in light of COVID. That non-congregate approach is better. And if you talk to Housing Matters and I think we have some of them on the call today, you know, they're seeing, you know, again, folks who weren't really interested in being part of their campus programs, much more interested in that model. So definitely, you know, it's on our watch list. And as I've said, we've acquired some, and they're in use in our community right now. All of these things, when we talk about them in concept, there's still the execution of them. How do you actually move? Is it transitional housing? Is it shelter? You know, are you saying, here, folks, this is your option for your permanent space? It doesn't have, well, you can get some with electricity and heat, but they're, you know, these are very, they're cute, but they're very minimal. But again, it's this question of where do we want to focus? Do we want to do our 150 additional beds in the form of a pallet shelter village? That could be one of the things we look at. And that's where some of the discussion moving forward is going to be very important.
Okay. Rainey, are there any more hands, or otherwise I'll keep going? Okay. So we have a couple more things that are kind of in between of a comment and a question. And since we have a little bit more time, we'll just roll through a few more.
Actually, Kate, as soon as I said no, we had a hand raised. So John Showalter, please go ahead.
Yeah, there's the chat room had talked about it a little bit, well, several times, and you started to talk about it, but the idea of managed encampment, pallet, the wagons, all this transitional stuff that doesn't put people behind four walls. None of that's in as a recommendation. You just talked about it as someplace up in the air. Why didn't this approach make it into the document?
Why? Well, because it's not it's not where we were landing. That is a much broader governance and jurisdictional conversation. I think by us saying what I just described, John, 150 more units, how you do that is part of the conversation moving forward. So I think that, you know, that's, you know, we need more capacity. We can articulate that. Now, what does it look like in our community, given what we need, what we can afford, where we can site stuff? That's part of the next set of questions.
Okay. It's not off the table, it's just not.
Oh, no. The point is, we didn't say build 2 75-bed navigation centers. No, we didn't say that. We said you better have some, and let's figure out what makes sense. And right now, 2 75-bed navigation centers modeled after something in San Francisco from 2 years ago would not be COVID compliant. So this is where we had this moment, and I think Randy went through what we thought we could have recommended 8 months ago. The whole world shifted. And so what we do now, we sort of have to stop, take stock. Okay, what does this mean now in terms of the pandemic, in terms of community receptiveness? I mean, some bold and some hard decisions are going to have to get made. And it's also creating a framework for where those conversations can happen.
Thank you. That was clearer. I'm a little dense.
All right, I'm going to ask one question that was been hanging out there a little bit, which is about youth. And this participant's asking, within the diversion and prevention efforts, is it possible to call out the unique strategies needed for the transition age youth group, which are youth under the age of 25, who make up nearly a third of the point in time count population?
I'll speak to that. So probably what would make more sense than calling it out in this document is referencing that we have a whole strategy, the Youth Homelessness Demonstration Project, where it is focusing on that population specifically. But I really appreciate that, is like, if we're not articulating where we have really, you know, a program in place, how does that fit into this? I think that's probably the gap I'd want to close in the plan, to reference, here's where that strategy lives. Here's the programs that we have funded. But yeah, I think that's important. People, that if we don't say that there's something already in the working in this particular population area, and someone comes to this as the document, as the framing, explaining document, you know, then it's a missed opportunity.
Okay, so we have one more, a new question at the end of the chat that I think is really important, and also maybe a good segue to start closing the meeting, which is asking about involving the general community, and particularly people currently or formerly experiencing homelessness. So this person is asking, that many of the people on the call have been invested in this work, but for the remaining and newly interested community, how is the general population engaged or homeless or previously unhoused population's opinions taken into consideration? And how can people stay engaged in the 6-month groups aside from a survey?
Well, I'll say, I mean, around integrating the perspective of people who have experienced homelessness or are currently experiencing homelessness, that's an actual sub-strategy within the plan, that we need to hear that voice in what we do. And there's some work underway to bring that forward, not just in terms of this framework, but moving forward, like in implementing these changes, we have to be informed by the voice and experience of the people we're serving. That consumer perspective is important. In terms of general public, I think that's a really good question. And I got to say, many of us have been involved in this one for a long time and trying to figure out the right way to, one, shine a light on the work and what's happening, because we don't do it very well. So I think part of that comes back to, how do we use data? How do we make public dashboards? There's that deeper question, though, of general public involvement in, you know, a government or in a service area. You know, what's the appropriate way to bring them forward and into it, and at what level? And I think that'll be part of the question for the new division and for the governance structure, is how do we make this process visible, these decisions visible, the priorities visible to the public?
Yeah, go ahead, Catherine. Do you want?
I was going to say, if I might answer the question, which was sort of the backward facing, how was the participation of homeless or previously unhoused populations taken into consideration? As part of this, over the course of the engagement, we did a couple of engagements that involved focus groups across the county. So the first was when we did the baseline assessment. We held focus groups in Santa Cruz and in Watsonville. In Santa Cruz at the Garden Project with a number of folks who were engaged in a number of ways, and in Watsonville at the Salvation Army. And then in the second phase of the work that Elisa talked about way back at the beginning of this call around the working groups that focused on shelter outreach and other parts of the work we were doing right away, we went back out and we did 3 focus groups in shelters. 2 in Santa Cruz, 1 at a roving shelter, 1 at a site-based shelter, and 1 in Watsonville with a Spanish-speaking population. So those were places where we very specifically asked for feedback from people about what their experience is and was of the way that the system currently operates and what they thought was most important. And I would say that I think a lot of the things that are incorporated, particularly into strategy area 1, but also throughout the plan, came from people saying what they had experienced that had worked and what they had experienced that didn't work or was very uneven across the county. So I just wanted to say that that was there. And then also that as part of this period that Randy described around how we're gathering feedback, in addition to the online survey that you all will be sent a link for, we're also going to do individual surveys with people who are experiencing homelessness right now that will not require going online to do them. So that's also a step to be taken.
And if I can piggyback on Catherine's how we got here and then a little bit of what we're doing next, referencing the next 2 months. During the 3 years, we're hoping to get better aligned between city and county. And I just want to name, we're government employees and our work is supposed to be transparent. The money we get is supposed to be transparent. This is too complicated a world and too complicated a puzzle. It's not clear to many people. So going forward, our board of supervisors as county employees, and then the 4 cities and their city electeds, we need to, in that world of governance, constantly throughout the 3 years, be bringing forward to the public in those public meetings what we're doing, how we're doing, and be open to conversations and feedback throughout the whole process. I will tell you, hopefully this is a pragmatic statement and not a glass half empty statement. We will not have enough money to do everything. And the goal tries to reduce homelessness by 30% overall, which still means there's a lot of people homeless. So the hope is that we will be in a place where something changes federally and state, where we have more money, where we can move the needle farther. The hope is locally, since we're so dependent on state and federal money that we can't control, that at least everybody better understands what money we have and the choices we've made. And therefore the energy is less spent on looking at county and cities to solve issues that we don't have the resources to solve. And we figure out how to harness that shared frustration, because we are frustrated too, and focus on advocating for state and federal change and resources so we have more resources. But right now we're not there. So it's understandable why there's a lot of frustration. So that's a goal. I hope that's responsive to the question. We are still beholden to our public officials and the public and public hearings that will play out throughout this 3-year plan.
All right, well, I think we're coming near the end. We have a few people who've asked some things about how they can be involved or how their organization can be involved, and we'll make sure and connect with you around that. And keep your eyes out for the survey link so you can provide input that way. And then Elisa, Randy, or Rainey, I don't know if there's any other closing thoughts you have or anything else you'd like to say as we wrap up.
I would just like to say thank you to everybody for coming and being part of this meeting and learning about the framework. And we look forward to sharing the link with you when the webpage is up and complete with all the information, including the framework itself, background materials, and the survey. Thank you all.
I would just add my thanks, and not just for everyone being here today, but for being here the last 18 months to do this work. And I really appreciate the diversity of perspectives on this call. And one, the courage to say, hey, what about this? Because we need that feedback. We need that voice. Now there's conversations there, we're not all necessarily going to be in specific alignment. And some of those things, we might say, yeah, we've done that, and this was what our experience was. But I hope everyone sees this, again, the framework as an opportunity to come together for dialogue, for figuring out what works and what's not working, and keeping our eyes on those outcomes for people, of getting more people housed, getting people's needs met. So I hope, I've really appreciated the perspectives here today, and we have to continue having these conversations.
And that would just be my closing comment, that I hope this is the continuation of a conversation for those who've been on board for this 18 months that were referenced. I only got here 9 months ago. We have 3 years, and I hope this conversation just continues. We'll keep talking.
All right, with that, I think we can close, and thank you again for coming.